MoCA Practice Test 2026 Montreal Cognitive Assessment, Full Course MoCA Clinical Settings. Question 1. What is the primary purpose of the MoCA in a clinical setting? To diagnose Alzheimer's disease. To screen for mild cognitive impairment, MCI. To measure intelligence, IQ. To treat memory loss. The MoCA is a screening tool designed specifically to detect mild cognitive impairment. Question 2. In which clinical setting would a MoCA most likely be administered? A pediatrician's office. A geriatric assessment clinic. An emergency room for physical trauma. A dermatology clinic. Geriatric clinics frequently use MoCA to assess cognitive health in older adults. Question 3. What is the total maximum score on the MoCA test? 20/30. 50/100. The MoCA is scored out of a total of 30 points. Question 4. A score of ______ or above is generally considered normal on the MoCA. 15/20. 26/29. A score of 26 or higher is the threshold for a normal cognitive result. Question 5. Approximately how long does it take to administer the MoCA? 2 minutes. 10 minutes. 30 minutes. 1 hour. The test is designed to be a rapid screen, taking about 10 minutes. Question 6. In a neurology setting, the trail-making portion of the MoCA assesses which domain? Language. Memory. Executive function. Orientation. The alternating trail-making task tests executive function and mental flexibility. Question 7. Who is authorized to administer the MoCA clinically? Only neurosurgeons. Certified healthcare professionals. Anyone with the paper form. Only pharmacists. While the form is free, clinical administration and interpretation should be done by trained healthcare professionals. Question 8. If a patient has 12 or fewer years of education, what adjustment is made to the MoCA score? Subtract 1 point. Add 1 point. No adjustment. Multiply by 1.1. To correct for educational bias, 1 point is added to the total score for individuals with 12 years of education or less. Question 9. Which setting would find the MoCA useful for assessing delayed recall? A memory disorders clinic. An optical shop. A physical therapy gym. A dental office. Memory clinics use delayed recall to check for early signs of dementia. Question 10. The MoCA naming task uses images of which animals? Cat, dog, bird. Lion, rhinoceros, camel. Elephant, tiger, bear. Horse, cow, pig. The standard MoCA, version 7.1, uses a lion, rhinoceros, and camel. Question 11. What does the clock drawing test in the MoCA evaluate? Vision and hearing. Visuospatial and executive skills. Calculation and math. Language and fluency. Drawing a clock requires planning, spatial organization, and executive control. Question 12. How is orientation assessed in the MoCA? Asking the patient's name. Asking the date, month, year, day, place, and city. Asking for their home address. Asking who the president is. Orientation questions focus on time and place. Question 13. In a clinical trial, why might the MoCA be preferred over the MMSE? It is shorter. It is more sensitive to mild cognitive impairment. It is easier to score. It is more colorful. The MoCA is generally more sensitive than the mini mental state exam, MMSE, for detecting subtle cognitive changes. Question 14. What is the letter A tapping test designed to measure? Finger strength. Sustained attention. Alphabet knowledge. Hearing accuracy. The patient taps when they hear the letter A, which tests their ability to stay focused. Question 15. If a patient scores 18 on the MoCA, this is clinically indicative of normal aging, severe dementia, cognitive impairment, potentially moderate, superior intelligence. A score of 18 is significantly below the 26-point threshold, indicating impairment. Question 16. Which domain is tested by asking the patient to repeat "the cat always hid under the couch when dogs were in the room"? Memory. Attention. Language. Abstraction. Sentence repetition is a test of language function. Question 17. What is abstraction in the MoCA? Identifying colors. Explaining how a watch and a ruler are alike. Counting backwards. Drawing a cube. Abstraction tests conceptual thinking, such as finding commonalities between items. Question 18. Serial 7 subtraction, starting from 100, tests which domain? Long-term memory. Attention and calculation. Visuospatial skills. Orientation. Calculation and concentration are required for serial subtraction. Question 19. Can the MoCA be used to diagnose a specific disease like Alzheimer's on its own? Yes, it is a diagnostic tool. No, it is a screening tool that indicates the need for further evaluation. Only if the score is below 10. Only by a nurse. Screening tools indicate a problem exists. A full diagnosis requires more comprehensive testing and clinical history. Question 20. In which setting would a blind version of the MoCA be used? In a dark room. For patients with visual impairment. For patients who cannot hear. In a psychiatric ward. The MoCA blind is specifically adapted for individuals with vision loss.